Let me say good afternoon, and today the Houston Health Department is reporting 773 new cases of COVID-19, bringing Houston's total to 38,516. So again, 773 new cases for a total of 38,516. And sadly, we are adding 8 more people to the list of those who have died as a result of COVID-19, bringing our city's total to 346. The list of deaths being reported is on the TV monitors, and it is worth noting that all the victims being reported today are people of color, people who are black or Hispanic, including a man in his 50s. And as you can see, the dates range from June 27th of this year through July the 12th. We also have another graph which shows the number of deaths that have occurred in our city by month. And as you can see, when you look at this particular graph, when we started reporting on the far left side in March, the number of people that died, that number was very low. From March, April, May, the number started to increase. And then once you get into June, you see how the numbers really increased exponentially, the number of people who have died going into July. Where you see those dips in June and July, pretty much those are the weekend where those numbers went down. But pretty much, as you can see, from March all the way through July, the number of deaths in our city, the number of cases, the number of increased exponentially. Oh, those are not the deaths. Those are the number of positive cases. Now, let me back up. Those are the number of positive cases, not the deaths. The number of positive cases that increase exponentially within our city. So my mistake. Those are the positive cases, not the number of people who died. What we are seeing also in the city is that through your efforts, and I certainly want to acknowledge the efforts of people in our city that are working collectively, because that's the only way we're going to slow the progression of this virus. We are seeing a slight drop in the positivity rate, which is good, and we need people to continue to put on their masks and to engage in social distancing. We are seeing a slight dip in the number of people who are going into our hospitals. That's good. With respect to those in ICU beds, that number is remaining somewhat flat. It's not going up exponentially as it has been, for example, over the last several weeks. So as some days the number of people in ICU bed drops down. We're still in the surge 2 capacity. Some days those numbers are lower, some days those numbers are a little bit higher, but we're not seeing the exponential sharp increase. So as it relates to our ICU beds, the number is flat. So we are needing people to continue to do what you have been doing because the goal is not just to flatten or bend the curve. The goal, and I think, and Dr. Persse can elaborate, the goal is to drive that progression all the way down such that the positivity rate is 5% or less. It's when we get to that point where it's 5% or less, it's when our testing and contact tracing program can really, really be effective at managing this virus. And that's what you see happening in New York and even in Boston, for example, is that the positivity rate in New York is significantly less than 5%. And the positivity rate in Boston, for example, is about 2 to 3%. And so our positivity rate is still right around 20%, 25%. And so we need to drive that positivity rate all the way down to 5% or below. So we still have a long way to go, okay? Though we're seeing some slight improvement in hospital admissions and in the positivity rate, some slight improvement, we still have a long way to go. And we're needing people to be very focused in keeping their masks on and engage in social distancing. Let me remind you, if you're around a group of people, for example, more than another person, yourself, and they don't have on a mask, you need to turn around and go someplace else. If you walk into a space and there's a large group of people, you really need to turn around and go someplace else. Have to exercise some individual responsibility, and quite frankly, that's whether you're outside of your home, whether you're in your backyard, front yard, any sort of gathering. So please govern yourselves accordingly so we can drive down this situation. 346 people have lost their lives to COVID-19 in the city of Houston, and city employees are also being hit hard by the virus. Earlier this week, we spoke about the deaths of 2 municipal workers and a Houston firefighter. I want to highlight all City of Houston employees who have lost their lives to COVID. 2 more died this week. This week, the Solid Waste Management Division lost a Deputy Assistant Director to COVID-19. 2 municipal employees assigned to the Houston Police Department have died of COVID-19. 46-year-old LaTanya Lewis, who was a Fleet Unit employee, died on Monday. Nicole Rodriguez, 38 years old, working in the Patrol Region 1 Command Office, died earlier this month. And earlier this week, we talked about Public Works employees Natavia Robinson, a customer service representative, and by the way, her brother is a Houston police officer, and then Michael Sanchez, who worked in the transportation and drainage operations ditch maintenance team. And then Monday evening, we learned of the death of Houston Fire Captain Leroy Lucio, who was assigned to a Kingwood fire station. Captain Lucio died in a hospital in San Antonio where he lived. And then finally, the human resource employee Angel Barnhart died recently of COVID-19. Let me just say, as the mayor of the city of Houston, and on behalf of the city of Houston, all of these employees were heroes for our city. They are frontline workers. They were essential workers. They were serving the people in the city of Houston. These were active, on-duty employees, and so we appreciate their service, and we send our thoughts and prayers and condolences to their families. Their lives have been forever changed. And so from my perspective, all of them are heroes and should be acknowledged as heroes, and we should remember them as such. As we remember our employees, let's also honor them by recognizing that the virus is real and it is spreading in our community. People who don't know they're infected, asymptomatic, are spreading the virus to others, staying home as much as possible, wearing a mask, social distancing, and washing hands are the ways in which we get this virus under control and restore our economy and our lives. As a reminder, our 2 City of Houston testing sites are open at Del Mar and Butler Stadiums, along with 2 testing sites temporarily open with support from our friends from New York at Fallbrook Church, 12,512 Walters Road, and Higher Dimension Church, 9800 Club Creek Drive. And so at this point, let me pause, and then let me bring up Dr. David Persse.
Thank you, Mayor. And I want to point out a couple of things that the mayor, reinforce a couple of things the mayor said. The virus is spreading throughout the community, and the graph that the mayor showed of the number of new cases, it looks, if you look at it, it looks like there's a peak there, and there is not a peak. The downside of that is just the lag in reporting. Remember, we're sometimes getting lab reports out to 18 days later, and so that off to the far right, what looks like a downslope, like it's an improvement, is not the part of the graph you should be focusing on. You should be focused on the part of the graph where it starts off, where we did have low rates, very low rates of new cases per day, and then when it started to take off. And so 2 or 3 weeks from now, we show this graph again on those dates to the far right, those bars will be much taller. So the virus is still very actively spreading throughout the community. We have not necessarily reached the peak. The hospital data is showing some slight, mild stabilization, maybe a little bit of dropping off of the total number of people that are in the hospital, but not the 700 or so, 650, I think it is, between 650 and 700 ICU patients within Harris County alone. Each one of those folks is extremely ill, and they're in an intensive care unit because they were infected by the virus. There's three things which will cause us to drive the numbers down, to get that positivity rate down to under 5%. One would be shutting down the economy again. That would be one. That's why our numbers were low back several months ago. One would be a vaccine. Well, we know that's a long ways away. One would be herd immunity. Just yesterday, the CDC published in JAMA a look at herd immunity within 10 major cities, including New York City and Seattle and others. And what they did in that was they took blood samples that were obtained throughout the community for a variety of reasons. So that's why it was a fairly random sample. And these were blood samples that had already been run for whatever test they were initially drawn for, and this was the leftover blood in those test tubes. And so they ran those blood samples to test to see if there was immunoglobulin indicating that the person had been infected. And for New York City, which has had the largest outbreak in the United States, the number of the blood samples that came back that showed someone had been previously infected was 6.9%. Now, we won't get to herd immunity within a community until we're at least 70%. And the more rapidly and the more easily a virus spreads like this one, the higher that number needs to be. So right now, there's some debate within my world, is it closer to 70% or closer to 80%? Well, we'll find that out at some point, but right now within New York City, the herd immunity is at less than 7%. So here in Houston, while we may be testing in some of our targeted neighborhoods, we're getting 25%. Don't let anyone misunderstand, think, oh, we must be getting close to herd immunity. We are nowhere near close to herd immunity. So going back to those things that will drive them down, the fourth thing that will drive down the rate of spread is those things that we keep harping on. Wearing a mask, social distancing, don't have large gatherings, compulsive personal hygiene, being smarter than the virus. That's what we need to do. New York City has the numbers down now. If New York City can do it, there's no reason Houston can't do it.
Thank you, Dr. Persse. Representing Chief Pinion today with the Houston Fire Department is Justin Wells, Chief of Operations. Justin.
Thank you, Mayor. Speaking of the fire department, currently we have 152 members on quarantine. It's down over the last week, thankfully, for the firefighters. Currently, we've had 193 members test positive for COVID, and of those, 37 still remained quarantined. It's unfortunate that we lost Captain Lucio this week to the virus. We're all mindful to wear our protective equipment and answer the call when called upon by the citizens. We've had over 5,000 exposures reported to our infection control office, and we've quarantined approximately 900 members since the start of the pandemic. The future, as long as we continue to be mindful of resources, mindful of our PPE, we can't answer the call when the citizens call upon us.
Thank you. And this Saturday, I will be joined by Councilmember Pollack, Councilmember Tiffany Thomas in Southwest Houston, the Health Equity Response Task Force with leaders from the Medical Care Subcommittee chaired by Dr. Kathy Flanagan, and the Faith Community Leaders Subcommittee chaired by the Reverend Dr. Aisha Hilliard and Pastor Steve Wells to distribute food and masks in the A-Leaf community. The event will take place from Saturday, July 25th, from 9 a.m. to 11 a.m. at the Notre Dame Catholic Church, 7720 Boone Road. We will distribute food, milk, masks, COVID-19 pamphlets, and medical-related educational materials. We expect to have enough for at least 2,000 people, so please come out. We will also provide educational materials in English, Spanish, and Vietnamese, and Chinese. Of course, all of this will be done subject to the weather. And here to tell us that we're going to have a beautiful sunny forecast for this weekend is Dr. Emeritus Chief Bunig.
Thank you, Mayor, for your leadership during this COVID crisis and for continuing to go out in the community and provide them the food and the PPE and the masks that they certainly need. I'd first like to express my condolences to the families of the City of Houston employees that COVID was involved in their deaths, and I'm really sorry to hear about that. Regarding the weather, the Office of Emergency Management has been in contact with the National Weather Service, and we've been monitoring the weather on a daily basis. This weekend, we expect the tropical depression to come into the city. Right now, the forecasts are from 1 to 3 inches inland. Looks like it'll be a little bit heavier towards the coast. 3 to 5 inches is what they're talking about at this time. So, Mayor, for Saturday's event, I think you ought to bring your raincoats and umbrellas, but it's probably not going to be as bad as next week. Next week, we're also monitoring a tropical storm, Gonzalo. It's already a named storm. It's way out there in the Gulf. Looks like it's going to be heading west. We don't know exactly where it's going to hit, but I am here to say that the Office of Emergency Management, along with the other city departments, have already been talking about the storm, preparing, make sure we have all of our proper equipment in place, so we will be ready in the event that the storm does hit Houston next week. Thank you, Mayor.
Please be weather alert, weather aware as we go into the end of this week, particularly on Friday, Saturday, be weather aware. And again, let me remind people, depending on where you are, you don't want to drive through heavy rain. You certainly don't want to drive through something you don't know how deep the water may be. So as we say, you turn around, don't drive. So be weather aware. Over the next several days, let's say going into next week, we can possibly be receiving a lot of water, a lot of rain. So Thursday, Friday, Saturday, be mindful. And then going into next week, be mindful. So pay close attention to the news and the weather forecast. Having said that, let me, I did, Mayor Pro Tem Dave Martin is with me today, and then Councilman Edward Pollack from District J is also with me today. Any questions or comments?